So we're here today with Maya Reisner and Tashana Brown. So let's get into the questions. So, first question I wanted to ask you guys is, let's start off with like an easier question. So, are either of you have like a fear of like blood or anything?
I have a fear of getting blood drawn from.
Okay.
It's a funny thing. We were practicing phlebotomy in the phlebotomy room in adult ed. Everybody knew I had to have this little stuffed animal dinosaur. And every time that they would go and draw blood from me, I have to clench it, and I'd be like choking this thing out. I felt so bad. It was terrifying.
So, for the people in the audience and everything, and also myself, what is phlebotomy exactly?
It's when you like draw blood and just use it for a test that you need to get done, like for any type of patient care.
Okay. So, do either of you guys have like, well, do you have a fear of having blood drawn? Is that more of the fear of the blood or like the needle itself?
For me, it's just watching the needle go in and my blood flow in the tube. That's what gets me.
Yeah, I feel like a lot of people have that kind of stuff. It's kind of like, blood is like life essence and everything. So you kind of feel like it's like part of me is leaving. So
yeah. But I mean, as long as I don't look at it, I feel okay.
Yeah. So one thing we wanted to ask you was, so I remember my co-host over here said you guys do surgery, if I remember correctly, on like practice surgery on bananas.
Yeah, I wondered what that was all about. Like, what was that meant to be? Because it just looked a little awkward from an outside perspective.
I don't think that was us that you saw. That might have been the first years. They started doing a lot of new stuff with them.
Okay.
But we have not got to do that.
Well, best to get the question out of the way and just ask because you never know. But what do you guys exactly do in your lab? Like, I know, it's health stuff, but like, and obviously you talked about blood being drawn and everything, but what's some other stuff that you do in there?
So junior year, the first semester is learning about infection control and like the basics of healthcare. And second semester, we get more into nursing assistants, which we take our test for STNA, and you can work at a hospital or a nursing home with it.
Okay.
Yeah. And we both work in nursing homes now.
So what do you guys go into your lab for exactly? Like,
you were asking what they were looking for outside of Apollo in terms of what they learned.
Yeah, like
that's what you're trying to ask.
Like, what type of health science are you looking to exactly go into after Apollo and everything?
Well, me personally, I'm enrolled in Rhodes, so I'm going to be going there. Get my associates in nursing. They just got a bachelor's program, so I'm trying to do that. And then afterwards, going for my master's.
Okay.
I want to be a nurse practitioner and specialize in either geriatrics or hospice.
Okay. My stepmother's a nurse practitioner, so I know a little bit of what that's about. Yeah. What are you planning on doing?
After I graduate, I'm going to ONU to get my bachelor's, and I will be nursing in pediatrics for a couple of years. I'm going to go back to school, and I might end up going back to school for biology so I can be an allergist.
Okay. And an allergist, is that like someone who studies allergies, or is it more of like treating allergies?
They kind of do both. Like, they're the ones that like they inject like what you possibly could be allergic to and see like how you react to it and if you are allergic to it or not.
Okay.
Yeah, I think that's pretty important to learn.
Well, yeah, no. Most of the health science field is pretty important because
yeah.
That's one of the reasons why people live so long nowadays.
It's practically the reason between life or death for a lot of people. So
yeah. So one question I wanted to ask is, do you guys plan on staying in America for health after college and everything, or do you plan on going to like another country or whatever for it? Because I know some people do.
I mean, if I could afford it, I'd probably move to Canada or like England or something like that, just because their health system and the way that they do things just with money in general is way better.
Okay.
So just in that way.
Do you?
And I plan on staying here because If I could move somewhere, I'm gonna have to learn a whole new language. And I took 3 years of Spanish, and I barely remember any of it.
That's facts.
So
It's better just to stay here.
Oh yeah.
So, let's talk about HOSA a little bit because I know you both went there, and say for the people listening, what exactly you guys did at HOSA and everything.
Well, I was a part of a team. There's 4 of us,
Okay.
and we went there for a biomedical debate.
Okay.
And this year's question was, should or should not nurses be charged criminally for mistakes?
Oh, okay. And you?
I went for health education last year and this year. Last year we taught teenagers. This year we taught first graders. So last year I placed 4th. This year I placed 3rd.
What did you teach to the first graders this year?
The first graders I taught basic hygiene, like hand washing, teeth brushing, and stuff like that.
Okay. So obviously, since it's first graders, it's not like, CPR or something. It's not
Yeah.
something big. But so one thing that Zach wanted to ask you and wanted to know was, do you guys do any like surprise like emergency drills, like like how in the ER
Because in the medical field, you usually would expect typically a sort of like surprise. Like you never know when a patient's about to come in, like with a major injury or something like that, or disease.
Yeah.
No, we don't perform those. We don't really get to do those type of emergency drills, but we are educated on like what to do.
Okay.
Like if someone started like dying, stop breathing, something, we would know what to do, like call 911, CPR, AED.
Okay. Is it okay if I just like ask another question on top of that? Do you think that your program should try to do something like that to get you more familiar with it? Because a lot of the time when somebody's told, oh yeah, I know what I'm going to do, when that moment occurs, usually people either know exactly what they're doing or they'll freeze up. Or do I need to reword that so you can understand it better?
No.
Okay, so like we learn like first aid, like what to do in an emergency situation. We just don't get like practice them really. Like we're both CPR and first aid certified right now.
Okay.
So you talked about CPR is quite literally what I was going to ask next. But have you in your lab, like I remember from like health class, which was like years ago at this point for me, we did CPR and everything. But do you guys have like different types of mannequins that you perform CPR on, like adult, teenager, kid, or is it just like one size all for mannequins for like CPR, or do you even use mannequins for CPR training?
Yeah, well, we have adult and baby. We don't need teenager because teenage like CPR would be the same thing as an adult.
We do have like child ones though. They're like smaller versions of the adult ones.
Okay.
Yeah.
Because I remember hearing like in health science, well, not health science, that's you guys, just health class in general, remove the science from it. You could accidentally crack someone's ribs if you do CPR the wrong way, but...
Oh, you're going to crack some ribs regardless.
Okay. So, I think you guys already stated it, but we'll go over it. Have either of you gone out in the field so far and done stuff? I think one of you maybe mentioned a nursing home where that's where you want to go into.
I have not, no.
I currently work in a nursing home.
Okay, that's what it was. Okay.
Yeah.
So, I mean, it's not bad.
Okay.
We get a lot of different people there. We have like a physical therapy type unit where people come in from the hospital, like Lemon Memorial, only to be there for like a month and then go home.
Okay.
We have other people who are like long-term residents. We have dementia care, and then we have assisted living.
Okay. I always liked nursing homes. They're quite, I don't know, well, they're soothing, I guess.
It depends if you work there or not.
Yeah, I guess that
Yes.
makes sense.
Yeah.
Like they can be soothing, but most of our older residents at my nursing home, at least, they're usually very high strung just because it's a stressful situation. Like you
Okay.
can't see your family 24 hours like you're used to. You're not in
Okay.
your own environment.
Oh, okay. I think it also helped with the one that I've been to before. Like, not in, but just like, went to see someone. They had like a bird cage and everything. So,
Yeah.
but have you guys ever, like, I feel like this would be maybe more fire and EMS, but have you guys ever gone over there and been like rode in an ambulance or something and done that kind of stuff, or would that be more of their thing?
That would be more of their thing.
Yeah, that's like more of their thing. But like, if someone does fall in the nursing home, like I can help them, like get them
Okay.
onto the stretcher and everything. I just can't get in the ambulance.
Okay. I figured that'd be more their thing, but asking is always better than not. So, have you guys what's the type of is there any specialty stuff that you deal with in there that wouldn't be common knowledge for most people? Like-
I feel like how to handle someone with Alzheimer's, that's not like common knowledge, because you
Okay.
think you would just treat them like as like a regular person, but they need more care and they need more attention than somebody else.
Okay. Yeah, because Alzheimer's is
Absolutely terrible.
yeah. But what's do you know the difference between dementia and Alzheimer's, or are they the same thing?
Alzheimer's develops into dementia.
Okay.
Yeah. At face value, it would look like they're practically different, but because of wording, but they're essentially somewhat the same. It's just
Okay.
Alzheimer's. This is from my opinion. I think it just is awful in general.
Well, yeah.
Alzheimer's is just the proteins in your brain. They're just not working correctly.
Okay.
They're dying.
So have you ever dealt with working with cancer patients or something?
Yes.
Okay.
I had a resident. He left, he went home, but he's been dealing with prostate cancer for 25 years.
Oh, okay. So he's been fighting it pretty good.
Oh yeah. He actually, he's still kicking it pretty good. He had one of his kids at 74.
Oh, okay. Even though he's got cancer, one of the worst types of things you can get, definitely not letting him let that keep him down.
No, he's enjoying his life. He's happy.
That's the best you can ever ask. Or that's the only thing you can really ever ask for.
Yeah.
So, have you ever performed surgeries and everything? I know we talked about the banana thing, but you said that wasn't you guys and everything. But have you ever performed practice surgeries in your lab, or?
No. The closest I've ever been to doing surgery was when in 8th grade I job shadowed at a veterinary clinic,
Okay.
and I was helping what was it called? We were fixing a female dog.
Okay.
I passed out.
Oh, okay.
Uh,
Have you?
No.
Okay. So this is probably a more recent thing for you guys, but when we came in the other day to, talk to your teacher about getting you guys in here for this episode, you guys were, or at least one of your classmates was working on a box or something. Mm-hmm. What was that exactly about, if you know?
Oh, that was just us working on our little hospitals that we make.
Oh, okay.
We make a 3D hospital. We pick 4 departments and make what a room would look like and everything.
Okay.
that's pretty interesting.
Zach, do you want to start asking current events and everything?
Yeah, I mean, sure. If you want to go ahead with that, you think you're
We
fine?
can do that. If anything, if we have more time at the end, we can switch back to more lab-centric ones.
Okay. So, have you two heard of the story about what's going on with fake nurse documents going around, or fake nurse diplomas?
Yeah.
You have?
Yeah.
Okay.
There's 8,000 nurses out in Florida who have fake nursing license and everything.
Yeah, well, it's recently been learned. It's also in Texas, Delaware, and New Jersey and New York. And as you stated, around 8,000. As of right now, the current estimates are over 7,600. And they're being sold $15,000 a piece from alleged reports. As of right now, the last report that I got, I don't know if you may have heard about this, happened 2 days ago. 4 women that were alleged nurses were arrested and fined in Harrison County of Texas.
Which I remember you talked about how that was what you talked about at HOSA and everything, being charged criminally, nurses.
Yeah, but that wasn't exactly dealing with all of these fake diplomas. It was
Okay.
more of if you make a mistake in the field that causes someone to die. Let's say it's a high stress situation and it's some surgery, and a doctor gives somebody the wrong blood type and it kills them.
Oh, okay.
If they should be charged and go to prison for that.
Okay.
That's a bit of a bit of a leap because, like, I mean, in our world, yes, it's like that's the worst thing about the medical field. Not to be like rude, is that it's making mistakes is a terrible thing at times, and it could be very
Yeah.
terrible. I don't think people should be charged criminally if a mistake is like in a high stress situation, like
Yeah,
because it's not
that's-
entirely their fault.
That's what That's what nurse license are for and everything.
Which is why fake documentation should be charged in any form, because that, like, if you don't know what you're doing and you're intentionally allowing yourself to do this, like, that's just not good.
Yeah.
Not all.
And it doesn't exactly help us out either. 'Cause from the Redonda case that went on last year, that doesn't help and give us any better of a name as nurses.
Yeah,
What
I
do-
feel like
Do
nurses
you
are always
know? Do you remember exactly what happened in the Redonda case? So
With Redonda, what did she do? She had done something to a patient. I think she like let them die. Like she wasn't able to get to the room or something in time, and they had died, and they charged her with like manslaughter or something with that,
okay.
involuntary. And
Okay.
I think she got like 8 years prison time.
Okay.
Hmm.
So I'll ask you this question. What do you guys think about vapes and everything, like from a health standpoint?
Well, me personally, I mean, it's everybody's choice if they want to vape or smoke or do whatever. It's your body. I just feel like before you do it, you should know every single risk.
Okay.
And vapes, I feel also shouldn't have been released or like given out to the public if they didn't know what everything's going to do to it, like what's
Okay.
going to do to your body.
Like how with cigarettes, like
We
you
found
ha-
out years later it causes cancer.
Yeah, exactly. Like stuff like that. Just you know all the lists and everything.
Yeah, and they also need to find a way to keep it out of the like hands of like young children. Because I know kids who are in middle school who are like 11 years old who are vaping.
Okay. Your standpoint on that?
I just like vapes. I feel like they like try to like target it towards kids than they do adults by using like different flavors and
Yeah.
everything, and like they try to say it's healthier than smoking cigarettes, and it's not because it's putting like metal and chemicals into your lungs, which can make like they can have to take out a part of your lung for that.
Okay.
Yeah, and statistics have shown that it's practically slightly or close to the amount that cigarettes would cause. So,
Okay.
Yeah, I think like one vape has enough nicotine that like 3 packs of cigarettes would have.
Oh, okay. And now this is something that I've more noticed, and it may not be more of a widespread thing. Like with the vapes, I feel like a lot of people, it seems, in the health industry, kind of understand that they're bad for you. But and this is more like, I guess this would actually go towards you too, because it's about allergy commercials and everything. How sometimes commercials will basically, you'll say it's an allergy medication for summertime allergies or something. And then it says one of the symptoms is depression or something. And what it tries to fix is like symptoms of depression, but it says it's an allergy medication. Like basically these companies basically mislabeling a type of medicine. So it's like it's a depression medication, but they're saying it's an allergy one. Two very different subjects.
Well, some medications could have double uses. Like,
Okay.
Psychologists, they might give you like a medication that might help out with one mental illness, but also helps out with another.
Okay. Zach, do you have more current event questions?
I guess in terms of current event, the only thing I really know of is about a bill being passed about troubles in the medical field in New Mexico, but not a lot of people really know that story. So
Okay.
it's mainly meant to focus on just like getting more people enlisted into the medical field because New Mexico's kind of having that problem right now. But beyond that, I don't got anything current.
Okay. So, do you guys have any stuff that you want to talk about in your lab that you do? Because obviously, you know more about your lab than we do and what you do in it.
If anything, I just think that having this program being in it is a great opportunity.
Okay.
I mean, it puts me 10 steps ahead.
Uh-huh.
Like, I have certifications and licenses I can fall back on.
Okay.
It's nice. I get a job. I have a job right now that pays me about 15. Phlebotomy, I get paid about 16, 17.
Okay, and like, is that like an hour? Is it
Like an hour just starting.
Oh, okay, just starting. All right,
Yeah.
that's pretty good.
Yeah, so I'm just happy that I was able to be in this program.
Okay, Deshauna.
I feel like this program helped me like get set up for a job and everything because we have job fairs. That's how I actually got my job that I have now. And me and Maya are both looking towards working at the hospital for phlebotomy right now.
Okay.
And I feel like the second semester of senior year is very beneficial because it's like a career exploration class. So like we have like dental hygiene this week and we can have something else next week if we're like not sure where we want to go in healthcare.
Okay. So one thing when you were talking about that popped up in my head that I wanted to ask you guys was, have you guys, like, since health field, do you also talk about like working in a morgue, or is that just something that would be more like a college level health thing?
I mean, you could work as like a medical examiner, like when you examine the dead bodies.
Okay.
I think last semester, Miss Roselle actually had a mortician come in because there's one student in her past class that wants to work in a morgue and everything.
Okay.
It's pretty interesting.
Yeah, I don't know why that question just popped up in my head, but I just felt like, hey, you guys may do that. So,
I think a pretty important. I think just a quick question. We didn't mention this earlier. Do you feel like COVID influenced your decision to go to health science, or was that just like?
No.
Okay.
COVID, like, I don't know, started my freshman year, and it never really bothered me in any way. I got it a couple times, but other than that, it's never influenced any of my decisions. That's it.
Yeah, and then for me, I've always wanted to go into healthcare since kindergarten, so I just didn't know exactly what I wanted to be, but COVID didn't really impact me at all.
Okay. So that actually brings up another question. What was the main thing that got you guys wanting to be in the health field and everything?
Well, originally this was not the plan,
Okay.
but my mom and my grandma influenced me a little bit.
Okay.
So,
What was your original plan?
well, I really, really wanted to be a history professor at a college.
Oh, okay. So it's definitely a change from the original, but
It's definitely a change, but I'm happy with it.
okay.
My job, for some reason, I work there like 6 days a week. I'm excited every day to go in.
Okay.
I'm happy.
That's a good thing. You're in high school, but you still get paid a pretty good amount, and you're happy to do it. Sounds perfect.
Oh, yeah, $600 a week. That sounds good to me.
Shauna, because you said you've been wanting to do this since kindergarten
Yeah.
and everything.
It's like in kindergarten, I didn't know like there was like different specialties in the healthcare. I just wanted to be in healthcare. And then like as I got older, I wanted to be a surgeon, but then I realized like touching someone's brain or something, I couldn't do that.
Okay.
Like I feel like I would pass out or something. So I started to look more into nursing, and then as of right now, I'm just considering nursing. And then if I want to further my education, I can.
Okay. Like, so when you brought up touching people's brains, that reminded me with my stepmother, who's also a nurse and everything. She's a nurse practitioner and everything.
Awesome.
So, and she actually works with a brain surgeon and everything. So, and well, I was gonna bring that up. You guys get paid pretty good in your field, right?
Yes.
Okay. It's like you had talked about with the job that you have now, you get paid like 16, 17 an hour or so.
No, the job I have now is like pretty close to 15.
Okay, 15. And then you said phlebotomy is 16,
Like 16,
17.
17.
Okay. Which is for a high schooler, that's a really good amount and everything, right?
Yeah, but for like an STNA specifically, I feel like we should be paid more than what we're given.
Yeah.
Yeah.
Because what we do is back-breaking work.
Okay. And it's also pretty important too.
It's very important. Like, it helps, and we also were a vital part in helping the nurses and the doctors figure out
Okay.
the care plans for the residents.
Okay. So to end this off and everything, is there anything else that you guys want to say whilst you're on the podcast?
Just thank you for having us, and really appreciate you guys taking an interest in our program.
Yeah, you guys interested me because while I was in here, I also originally wanted to do somewhat being in a morgue and everything, but then I realized that I feel like this fits me better than that because of the amount of science and everything. Like I like science and everything, but it's like after a while, because math also tends to be a lot in science.
Yes.
I'm not very good with math, so I changed it, and now I'm going to college for multimedia and stuff. So
Thank you for you all agreeing
Yeah.
to come onto the show, and hope you enjoy the rest of your days.
All right. Thank
Yeah.
you. You as well.
Yeah.